million people have lost their health insurance because of the COVID epidemic and because they lost their job. Improved Medicare for All would provide automatic coverage of any United States resident, and it would be comprehensive coverage.
My name is Leslie Leff. I am a Chesterfield, Massachusetts resident and an educator and a clinical social worker. But I'm here today as a member of the Hilltown Medicare for All advocacy group. We are a group of residents from the Hilltowns of Western Mass, and we're really concerned about access to and financing of healthcare. Our goal is to educate the public about Medicare for All and to advocate for its implementation on both national and state levels. We're hoping to share a series of video conversations to answer questions that the public might have about Medicare for All. And I'm really happy to be talking with my fellow group member today, Dr. Christopher Flory. He's a Williamsburg resident, and he practiced primary care and internal medicine in Northampton for 31 years. As a solo practitioner, he had to be deeply involved with many different kinds of health insurance companies. So he is very well qualified to talk to us today about Medicare for All. So welcome, Chris.
Morning.
Morning. So during the debates, the Democratic primary debates, we heard so much about Medicare for All. And a lot of people wonder, is this the same thing as our current Medicare, or is it actually improved?
It certainly is very different from our current Medicare. Current Medicare has never been a standalone insurance plan. There were holes in its coverage. It only paid for 80% of office visits. It had bad pharmaceutical coverage. So people, in order to get adequate coverage, needed to purchase some add-on insurance plan, whether it was a Blue Cross Medix, whether it was one of the Medicare Advantage plans that are very popular. And each of those had co-pays and deductibles, but it never really stood alone. Improved Medicare for All, which is what we're talking about, is an absolute standalone policy. Its coverage would be very comprehensive. Everybody who was a resident of the United States would automatically be covered, and there would be no co-pays and deductibles. So it's very different from the current Medicare.
Okay, that really helps. So let's refer to it as Improved Medicare for All, so it can be clear that that's what we're talking about. Thank you. That's a really helpful distinction. So also, a lot of people have been talking about, I've been seeing a lot of newspaper articles about how COVID-19 has highlighted some of the problems that currently exist in our healthcare system. And what do you see as the major difficulties with the current system and why it needs to be changed?
I think certainly the COVID pandemic has shown some of the major problems, but they were there before. The major problems I see, number one is access. People don't have health insurance. There were something like 40 million people before the COVID epidemic, and now about 5.5 million more who don't have health care coverage or are underinsured. And there are areas of the country where they don't really have good access to primary care or medical care. So access is number one. Cost is number two. We'll talk about these later, but we pay twice as much as any other country, and it is becoming unaffordable. Businesses that provide health insurance are screaming bloody murder because of the cost they have. And problem number three is quality. We think we're getting terrific quality care, but if you look at it on a population basis, we are not.
Yeah. Wow. So you've covered a bunch of kind of details about each of those things, but let's break it down a little more. So specifically, how would Improved Medicare for All change the access to healthcare? And like I said, you highlighted some of them, but.
Yeah, as I mentioned before the COVID epidemic, there were about 40 million people who were uninsured or underinsured. And the latest numbers are that I've heard 5.5, I've heard 5.7 million people who have lost their health insurance because of the COVID epidemic and because they lost their job. So those people have no insurance to pay for their medical care, and improved Medicare for All would provide automatic coverage of any United States resident, and it would be comprehensive coverage. So the access problem would be greatly improved. It has no relation to employment. So the employer dependency, the malignancy of which has been shown by this COVID epidemic, would be gone. Your employer, not only if he fired you, you would still have your insurance. If you wanted to change jobs, you would still have your insurance. Your employer couldn't pick a different health plan and require you to go to a different group of doctors and hospitals. It would be totally independent from employment, and I think that would be a great benefit.
Yeah.
The COVID epidemic has also shown that the inequities in healthcare is much more than I think almost anybody had expected. That the non-white population has had a much higher COVID infection rate as well as mortality rate. There are a number of reasons for this. One is that they have more pre-existing conditions based partly on their poor use of primary care because they can't afford it, in some cases can't find it in their area. And also we've learned that the people that are essential workers, they stock the shelves in the grocery stores, plus the primary responders, the great majority of those are in the Latino and Black populations. And they have to keep working because they can't pay the rent and pay for their food if they don't. So they've had to put themselves out there and expose themselves to the COVID epidemic. And so therefore their infection rates are much higher than the white population.
Wow. So yeah, so the access to healthcare is actually part of the system of actually systemic racism. So that's important too. And then also, like, I think that you talked about universal coverage, right? You were emphasizing that improved Medicare for all would be universal no matter what your pre-existing condition and from cradle to grave, right?
Absolutely. It would be cradle to grave coverage, and everybody who's a resident of the United States would automatically be covered.
Wow, what a difference. All right, so a lot of people are talking about cost. How would improved Medicare for all change the cost of healthcare?
At this point, the estimates we pay are somewhere in the neighborhood of $3 trillion for healthcare in this country, which is double any other country. And as we'll get to, our results do not justify that, but it's very expensive. How can we lower that? Number one, the overhead. The private insurance has an overhead of around 25%. So that's money that we're all paying, and that doesn't go to healthcare. It goes to pay the people to advertise, pay the people to debate claims, to handle the appeals, that kind of paperwork, which is not patient care. Medicare, despite having a sicker population, has had an overhead of 3 to 5% for a number of years. Number two, prescription drugs, as I may have mentioned above, Medicare is prohibited from negotiating drug prices with the pharmaceutical industry. That was part of Medicare D, which covered prescription drugs poorly, but prevented that kind of volume negotiation. Under improved Medicare for all, Medicare certainly would negotiate much improved drug prices. And number three, unless our society is willing to allow uninsured and homeless type people to die on the streets, we're covering their care anyway. When they present to the emergency room with COVID or any other problem, they get taken care of because that's what our society has decided it needs to do. That's very expensive care when you intervene at that point. Improved Medicare for all would provide much better preventive care benefits, so people would get cheaper preventive care rather than presenting to the emergency room exceedingly sick with COVID or any other problem. So that would be cheaper also.
That's such a good point. I think that, when we think about cost, when we think about Medicare for all, sometimes people think like, oh, it's just about, being kind to people, which is great, but it costs too much. But that's such a good point, that preventative measures would also lower the cost. Wow.
And we won't go into financing much today, but if we take the $3 trillion a year we're spending on healthcare now and make the savings, some of which I've referred to, we could afford improved Medicare for all for everybody.
Wow. Wow. So Chris, what about the quality of healthcare and how improved Medicare for all would impact that? Because like right now, like I know we pay so much, but like we're the United States of America? Don't we have the best healthcare system in the world?
If you live in Boston and get all your health care from Mass General, I don't think anybody is going to debate that you get the best health care in the world. But if you average out the populations and what are the results in multiple studies of our health care, it's mediocre at best. If you look at hard numbers like maternal mortality rate, infant mortality rate, life expectancy, we come out mediocre at best. And by providing continued preventive care to prenatal care, a good care for infants whose mothers have had the prenatal care, we would definitely improve things like maternal mortality, infant mortality, and life expectancy. And in most of those, we are way behind other industrialized countries.
Wow. Wow. Oh, well, so improved Medicare for all sounds really, really great. And if that's the case, why are we hearing talk about a public option?
Really, we heard a lot of talk about a public option in the Democratic presidential debates, mostly because of political expediency. Obama wanted to get a public option through, along with a number of other things that he also couldn't politically sell as part of the Affordable Care Act. The Affordable Care Act was a significant improvement, but the public option, the way it works, and it's being discussed again now, or will be, is simply allowing everybody the option to buy into a currently available plan. Sometimes they're talking about a public option to buy into Medicare, sometimes into private insurance, but it still keeps the high costs of those and does not cover everybody. We know that when the Affordable Care Act went in, Obama had a penalty for people who didn't get health care. An awful lot of people still chose to not get health care. So if you have a public option, a bunch of people will still not exercise it. It also can't control cost. The Affordable Care Act never really was intended to control costs because Obama could not get that included. So the public option doesn't solve really any of our problems. It would not get everybody covered. It would not solve the cost problem, and I don't see how it would impact the quality problem very much either. So improved Medicare for all would solve those problems, and the public option would not.
Okay, that's really helpful. And perhaps we'll have another video conversation to even go into that more in depth. But thank you. I feel like this was really illuminating about Medicare for all. Hope for you and the public that we've answered some of your questions today. And that,
I guess the one more thing I would throw in is that what we're going to hear about in the fall after the election, if Biden is elected, he is very committed to the Affordable Care Act, to improving it, and I'm sure he will add a public option. So one of the questions is going to be, how long does it take our next president and our political system and the people to realize that that's not enough, that they really need to go farther than the public option? That's going to be, I think, an important discussion this coming fall and next year.
Okay, no, really good point. Thank you, everybody, for coming today. Thank you, Chris, for this really interesting conversation.
We were really happy to have you join us today, and we'd love to have you join us again. You can check out other upcoming videos on our YouTube channel. And of course, please like and follow us on Facebook at Hilltown Medicare for All Advocacy Group. And finally, if you'd like to learn more about our group or come to some of our meetings, we would absolutely love to have you. Please contact us at our Gmail address, which is on your screen right now, Hilltown MFA Advocacy Group at gmail.com. And we hope to see you again. Thanks so much.